Uh, why this topic is important? Because most of the time, the radiology skills, especially in medical colleges, are underemphasized. You should know about the important radiologic modalities, means the different type of investigations or the imaging that is available in order to investigate a particular patient. Radiology is unfortunately a relatively weaker part of our curriculum because it is usually inducted when you are in your final years. So we have to give it a little bit of time in order to be a good physician. So whenever you are ordering any investigation, any radiologic investigation, any imaging investigation, you should be able to identify appropriate imaging for the patient or for the condition that you are investigating. So today I'm going to give you an orientation regarding the 7 radiologic testing modalities. And these are the 7 radiologic modalities that you usually come across. The most common are the plain films, the X-ray films, then there are the contrast agents. We will discuss the contrast agents in a little bit of detail. These are the different radio-opaque or opaque materials which are administered to the patient either intravenously or intraluminally to see the organs which are not visible on the plain films. Then there is CT scans. You might be aware of their presence as well as their use in some of the patients in your life. Then a very common imaging is the ultrasound. Then there is nuclear imaging or the PET imaging, you can say, magnetic resonance imaging, MRI, and the PET scan, the positron imaging tomography. So first of all, we will discuss the plain films. The plain films are formed by the attenuation of the X-rays. So in order to look at any X-ray, there are multiple basic densities which you should remember in order to differentiate either one region from the other or from one organ from the other organ on the plain film. These 4 basic densities are the air, fat, water, including the blood and the soft tissues, and the bone. I will show you these 4 densities on plain film. This is a typical X-ray unit. You can see the X-ray tube, the table on which usually the patient is placed. This is the stand where the chest X-ray is performed. Here you can see the plain film for an hand examination. The 4 densities that are visible to us are the bone, the soft tissues, the fat or the subcutaneous tissues, which are barely visible along the border of the soft tissues. And then there is air. The air has got no application with this X-ray, but when we perform chest X-rays, it is a very important part to look at the parenchymal tissue of the X-ray of the chest filled with air. Here you are. Again, there are 4 basic modalities, or you can see the densities. The blacker one is the air. You can see the mediastinum and the soft tissues of the body. There is bony structures as well. The soft tissues below the chest, and there is subcutaneous side, which is comparatively a little less denser than the soft tissues. You know, X-rays are also used in other parts of our life. When you pass through a search gate in the airport or in an hotel, there is a instrument or equipment which scans your luggage, and it is through the X-rays that they are able to see the stuff that you are carrying. Now, contrast agents. You should have a little bit of idea about the contrast agents. The contrast agents are the different drugs which are given either intravenously or within or intraluminally, for example, in the bowel or within the urinary tract, or either at the local tissue to give a visualization of the structures that they are filled with. So there are few disadvantages of contrast agents. Most of these are adverse reactions which are quite mild. Whenever an intravenous contrast is administered, patient may feel a little bit warm, a metallic taste in the mouth. But in some patients, there may be severe reactions, including the anaphylaxis and patient going into the hypotension as well. There are multiple types of contrast agents. Usually, the low osmolarity agents are used. The chances of reactions are about 1 to 2%. In case of intravenous reactions, we should keep in mind that they may be nephrotoxic to the patient, and they should be used carefully in a patient who have already compromised renal function. Here you can see an example of the contrast that is outlining the pelvic glycol system, the ureters, as well as the urinary bladder. It is an IVP examination, intravenous spyelogram. The contrast has been given intravenously, and it has been excreted through the kidneys into the pelvic glycol system and the bladder. And you can see the delineation of the pelvic glycol system, ureters, and the bladder as well. It is a normal examination. There are no pathologies involved. Here is the second example of the intraluminal contrast. Barium has been given. It is an examination of barium enema. The contrast is outlining the large bowel. These are the different parts of the large bowel that you already know: the cecum, transverse colon, rectum, the splenic flexure, the hepatic flexure. It is also a normal examination. No pathology is seen. Here you can see the axial image from an MRI examination. You can see the different vascular structures, the blood supply of the brain, and these vessels are filled with contrast. If they are not filled with contrast, you will not be able to see them in this examination. Again, it is a normal examination. No pathology is seen. This is another example of intravenous, or you can see the direct administration of contrast into one of the coronary arteries, and delineating or showing you the different coronary arteries and their branches. This is a spot film from a contrast examination of the heart, the cardiac angiography. These are usually the moving images, the cine. This is one of the static images taken from the full examination. Again, there is no narrowing of the vessels, and this is a normal examination. Then comes another modality, the CT scans. CT scan is also full of radiation, means it is also it also uses the X-rays, where you can see the ionizing radiation. The main advantage that we have over the plain films in CT scans is that most of the organs, whatever we are imaging, either the brain, the heart, or the abdomen or the chest, you can clearly differentiate one organ from the other. The images taken in CT scan, this is a typical CT scan machine. Now, the advantage, you can see this is a CT scan brain. You can see the different images. These are the axial images. Axial means you can also perform the coronal as well as the sagittal images, but these images shown are the basic source axial images. The main advantage is that you can differentiate one organ from the other simultaneously, and the major disadvantages is the amount of radiation that is going into the patient at the time of the scan, which is usually quite high, multiple times as compared to the plain X-rays. There is another example of CT scan abdomen, axial image. You can see the liver. There is some pathology. There is a neoplastic lesion of this is CA gallbladder. The walls of the gallbladder are calcified. You can see this abnormal or density or structure, whatever you call it, or area. This is pathologic. Otherwise, you can see the kidneys, the liver, the spleen, and the bowel as well. This is the aorta, which has got some calcification. You can see the vertebra and the ribs that are visible peripherally. Ultrasound. Ultrasound is another very common investigations carried out most of the times. The main advantage is that it has got no radiation involved, so it can be performed safely in most of the situations. And then another main advantage is that it is in real time. You are performing and as well as looking at the images right away. So due to its non-radiation nature, it is most frequently used in obstetrics as well as when you have to look at moving structures, for example, in echocardiography. This one advantage is that the sound waves are usually obscured or obstructed by the bone as well as the air, because air is not a very good medium for sound waves. And another main disadvantage is that it is operator dependent. Means if you are very good at performing the examination, your findings may be different from someone who is not very good in performing the ultrasound. Here you can see a typical ultrasound machine. The main crux of these machines are these probes, which are used to scan the patient. Here again, you can see different kinds of probes. This is the endocavity probe and different probes which are used percutaneously to examine the patient. Here you can see a static image from a fetal well-being examination, ultrasound of a fetus. This is a sagittal image. You can see, you can appreciate the head, the neck, the abdomen, including the chest and part of the lower limbs. These are the part of the upper limbs. Again, a normal examination. Another picture from an ultrasound examination of the abdomen. This blackish structures, or in the terms of ultrasound, it is called anechoic structure. This is a normal gallbladder. Here you can see a whitish structure that is present within the lumen of the gallbladder, and it is a gallstone. Nuclear medicine. In some of the examinations, especially in patients when we are looking for any widespread metastasis, nuclear medicine or nuclear imaging is used to find out the spread of metastasis within the bone, either within the bone or within the soft tissues of the body. There is avid uptake of glucose bounded with radioisotope, resulting in the flare-up of that lesion when the examination or the scan is performed. This is a typical gamma camera used for in nuclear imaging. Here you can see an examination from the bone scan. You can see there are multiple dark, somewhat oval or rounded structures which are diffusely involving the bone. There is as well as the spine which is visualized, the long bones of the upper limb, and some of them are also involving the skull and the part of the bones of the face. All these are metastatic lesions coming from a primary pathology. We don't know the primary pathology for this patient. Here you can see the single positron imaging computed tomography from heart. This is also known as thallium scan. These images are usually not very accurate anatomically, but you can see the different colors. These colors delineate the amount of radioisotope taken by the tissues. MRI, one of the evolving modalities of radiology. The main advantage is that no ionizing radiation is involved. It is usually based on magnetic fields. It is very commonly used in the examination of central nervous system. The contrast agent may be used in MRI as well for delineating the blood vessels. The main disadvantage is that if you are carrying some metallic object into your body, sometimes there are multiple metallic processes or some stents, then the patient is unable to go into a MRI machine. And the substances which are magnetic in nature are kept away from the machine. This is the typical MRI machine. Here you can see a sagittal view of the MRI brain. The delineation of the different structures, especially the soft tissues, is very good in MRI. Again, this is a normal examination. MRI, sagittal image of a cervical spine examination. You can see the spinal cord, the vertebral column, trachea, the blackish one, and the soft tissues of the chest and adjacent to the upper neck. Again, in normal examination. Here you can see what is the problem. The patient is unable to go into the gantry due to his or her size. That is one of the disadvantages whenever a gantry is used, either in CT or MRI or PET scan, whatever. The table is compatible for a particular weight, and the weight which are more than that are not put on that particular table. PET scan, the positron emission tomography, I have already shown you some of the images from that. It is basically used to identify the benign structures from the malignant ones. A CT PET scanner. In this machine, simultaneously the CT as well as the positron emission tomography is performed and the images can be overlapped. Here is one of the image from positron emission tomography. You can see the different. It is one of the image from the brain examination, and you can see the different colors. These colors are due to metabolic activity of the brain. This is a functional scan. You can diagnose the actual functioning of the different parts of the brain through this examination. Again, the whole body positron emission tomography scan. Summary. So whenever you are ordering a radiologic test or imaging that you are about to use in your patient,